Hi, my name is Franco Greco from Your Psychologist, based in Elstonwick, Melbourne, Victoria. Today is another series of my 5 and 5 key questions that clients ask about a particular area that covers my practice. And I thought today I might continue on with the couples therapy questions that couples ask. So another 5 key questions. So last time we talked about this. I talked a bit about the key questions: what's your experience? What's my experience in couples therapy? What's my approach or therapy style? How long does a therapy process take? And what to expect in the first session, and what are the costs associated with couples therapy. Today, I want maybe another question that people ask is what do you specialise when it comes to the relationship issues, such as communication, infidelity, intimacy issue. Couples might have specific concerns and want to know what the therapist specialises in. So I tend to work with a whole range of issues that couples experience: frequent arguing, escalation, difficulty in communicating. Couples might have different ways of communicating. Some people are far more avoidant, they don't like dealing with conflict. Some want to engage in conflict, or want to engage in bringing up issues. There could be trust issues, particularly in regards to when there's been affairs or infidelity. Infidelity could also be not just affairs, it could be also hiding things away from your partner, like a drug addiction or a substance use or a gambling issue. There's often issues associated with dissatisfaction of sexual, emotional intimacy, coping with shared trauma or grief. So there could be a death in the family, there could have been a child that passed away, past grief and trauma that they each may have experienced. Inability to respond in a healthy manner during a conflict. So this is when they engage in what the governments call the 4 horsemen: high levels of criticism, defensiveness, contempt, and stonewalling, which leads to escalation. Problems of codependency, as I said before, addiction, substance dependency and use, and/or domestic violence that might emerge or become more evident as we engage in couples therapy. The second question is, do I offer remote or online sessions? I provide a range of approaches, both face-to-face and online. I have a lot of couples that have really good outcomes, even with online, like in other states, so in South Australia and New South Wales, and also international. And the key issue here really in that regard is really about trying to make it as comfortable as possible. And I think it's really the relationship between the therapist, me and you, that's the most important thing. In some respect, it doesn't really matter if it's online or face-to-face. Some people prefer face-to-face, and we will accommodate that if people want that, or online. Okay. The third question is, how do I maintain confidentiality in the therapy? This is a really good question, particularly around couples therapy. The only way which I would the only breach of confidentiality, or where I would breach confidentiality, is if you're a risk to yourself or someone else. That's with individuals and also with couples. In couples therapy, as well as an individual, my notes could be subpoenaed for a court, and I've got to comply with that subpoena. The other thing around couples therapy specifically is that one partner might seek something out from me, right? Might tell me something that they don't want to tell the other partner, and I work with that partner to reveal that information, because I can't be holding information away from the other partner. So I make it really clear up front. All communication is done between the 3 of us, not just bilaterally between one partner and myself. And when someone does do that, I always respond to the 3 people, not to the individual person. Now, if there's something that's come up that they really want to talk to me, for example, around domestic violence, that they fear raise an issue, that's a concern about the risk to the person, and then I would not breach confidentiality with that particular person. And I'll try to encourage that person to work through what their best options are. Gottman's talk about two types of domestic violence. Situational domestic violence, which is escalations that might lead to a violent interaction. That is situational. It's not chronic. It happens once in a while. It could happen in a way that is infrequent. Characterological domestic violence is when there's coercive control or there's a chronic, perpetual domestic violence situation occurring where there's a clear perpetrator. And then I have to work with that client who's the victim of that to help them. And they may not want to reveal what they're telling me about that to the other person for good reason. I hope that explains it. I'm happy to answer any questions if you can leave any commentary below at the end of this video. The fourth question is a really good question, which is really about how do I deal with conflict within, disagreements or conflict within the therapy room. Potential clients might want to know, how do I manage conflict? I think the issue here is it's like exposure therapy, couples therapy, is that conflict will arise in the therapy room, and that's okay. In fact, I try to encourage it so I can see how a couple operate and what their coping mechanisms they engage in, what behaviour they engage in, how do they respond to the other partner. And it's only through that exposure that you can then develop some strategies, learn some strategies to implement in the session itself. And so that's a really important part of the therapy process. And so I'm respectful to each client, I'm respectful to each of the partners, I listen to them, but I'm also not going to tolerate someone engaging what they call, like I said, the Gottman's 4 horsemen approach, which is being criticised. If someone's been criticising the partner, I'm going to stop them. Hey, you're critical of the other partner, and you've got to stop doing that, because that's what you're doing. Oh, I think you're being a bit defensive there, right? You're raising your voice. Can we tone it down a bit? Because it's not helping in this situation. Okay, so the fourth question is, I think we've covered off a range of these things. So we covered off disagreements, we covered off specialization, we covered off remoteness or online therapy and confidentiality. That was the fourth question. What's the fifth question? Okay, can you work with individuals' issues while also improving the relationship together? So some couples want to know if therapy can address both personal and relationship issues simultaneously. I guess my key issue here for me around couples therapy and all the therapy that I've done with couples, and it's a large part of my practice, 40% of my client base are couples, is that couples therapy is often trying to help a partner to understand that the problem doesn't always reside in their partner, that they've got to take responsibility themselves, and that requires them to also look at themselves and say, hey, what can I do? What can I do differently here? We bring a lot of our baggage into relationships. We want our partner to resolve them for us. And sometimes that's impossible for the partner to do that. In fact, it's impossible for them to do it. I think the key issue here in some respects is to recognize that you're always doing in couples therapy personal work, always. And sometimes there will be a situation where I might need to do an individual session, a couple of individual sessions with a partner to help them process that issue, but not forever. Because remember, the client here is the couple, not the individual. It's the couple, not the individual. It's important to recognize that. I am there for the couple, but it sometimes requires some individual focus for a few sessions. I hope this helps. Leave a few questions, leave any commentary or any key questions you want to have there that I can answer. I'm happy to do that. I hope you found this very useful. You can always go to my website as well, www.yourpsychologist.net.au, and you can find some other videos that I have that might be helpful for you if you're making a decision to enter into couples therapy or any other type of therapy. All right, goodbye from now.